Hello, welcome back to Mirror Interpretation Todorova. My name is Ioana and I am an interpreter. Today we are recording another medical interpreter consecutive practice sample that I called a nurse call. And this is going to be a session where I'm going to read and then I will give you space to interpret. This is consecutive. I think this is pretty easy compared to the other one, so let's start. Hello, this is Jane, nurse care manager, calling you from River Springs. Hello, Anna. I'm calling you today to welcome you in River Springs. How are you feeling today? Yes, I don't know yet. I feel a little bit tired. Oh, have your homemade services started? Did the homemade started to come to your home and help you? No, they haven't started to come yet. No. Well, the 1st of December, they were supposed to start your homemade service. The 1st of December, I think, yes, Wednesday. Oh, yes, they come, but I'm not sure if this is you or it's from Fredelis. I don't know yet exactly. Oh, you do have a city pass called Master Aid. This means that your daughter have to come to you to help you and they should pay her to take care of you. Oh, my daughter, I am all the time with her. She's here with me all the time. Okay, all right. Do you need any supplies for urine incontinence? Of course, yes, I need them obligatory. Yes, for sure. Okay, what do you need? Yes, I have the urinary incontinence and I need the urinary pads, or I don't know how they were call it, but my daughter would be here soon. Oh, I think you're talking about the liners. How many liners do you use a day? I have urinary incontinence, so I change them very often. I cannot tell you how many I need, though. Okay. Is there anything else that you need? Yes, I do have those things like underwear or pads. I think they're called pull-ups, but my daughter knows and she would tell you what I need. Okay, please, when your daughter come to you and you know what do you need, tell her to call me at 1-800-370-3600. All right? She should be here in 30 minutes or an hour or something like that. Okay. Does she have to ask about someone's name or something? She just can call and tell that this is for Jane, nurse care manager, and that's it. This is your care manager, so when your daughter call, just to ask for Jane. Oh, okay. I understand. Your name is Jane. All right. Okay. Thank you and have a great day. And thank you for being here. I hope this was useful practice to you guys. Um, thank you as well. And I hope you enjoy it. Don't forget to press like, share, and subscribe, and also have a great day.